Sakra World Hospital's Facebook page. Today we're here to discuss more about pediatric anesthesia, and with us we have the HOD of Anesthesia Department, Dr. Shishir. Welcome, sir.
Thank you.
Could you tell us a bit about yourself?
Good evening. I'm Dr. Shishir. I'm a pediatric anaesthetist and the head of the Department of Anesthesia at Sakra World Hospital. I did my MBBS and MD from Government Medical College, Mysore, after which I went to the United Kingdom, where I spent 12 years training, 4 of which were exclusively in pediatric anesthesia. Prior to relocating to India, I was a consultant pediatric anesthetist at the world-famous Great Ormond Street Hospital in central London. I've now been back for about 3.5 years, all of which I have spent at Sakra World Hospital.
Okay. So, sir, a few questions about pediatric anesthesia. Why do children need general anesthesia in the first place?
It's chiefly to facilitate surgery, so no surgery can really happen without anesthesia. So I would say 60 to 70% of the anesthesia that we do are to facilitate surgery. But increasingly we are also giving anesthesia for investigations like a MRI scan, a CT scan, and also for procedures like lumbar punctures, bone marrow aspirates in children. So I would say 60 to 70% surgery and about 20 to 30% for imaging.
Okay. Also, kids need general anesthesia for MRI scan. Is that true?
Yeah, that's a good question. I mean, the MRI scan in itself is painless and does not involve any radiation. So I have had many parents ask me, why do they need a general anesthetic? It's mainly because children can be very scared in unfamiliar surroundings. And if you go into an MRI scanner ever, you'll know that it's quite a claustrophobic feeling. And many adults request anesthesia, let alone children. The other reason is that they need to lie absolutely still for us to be able to get good quality images that can then be interpreted by our radiologists. Okay. So 2 reasons mainly. One is anxiety, and the other for technical reasons, so that we can get good quality images. That's why we need general anesthesia.
All right. So we keep hearing a lot of negative news from time to time regarding anesthesia. So what do you think? How far is anesthesia safe?
Well, that's very true actually. All the news that we hear about anesthesia is predominantly negative, but we have to put things in perspective. Now, I'm not trivializing that every single case that happens that hits the newspaper headlines is a tragedy for the patient, for the family. But just to put things in perspective, every year about 2 to 3 lakh, at least 2 lakh patients undergo anesthesia in Bangalore, and probably twice that in Karnataka. So we are looking at 4 to 5 lakhs, and you're probably hearing isolated incidents. I mean, it's not to say that these incidents don't happen, and we have lessons to learn from them, but by and large, anesthesia is very safe. Okay. In experienced hands and in good centers, mortality due to anesthesia is come right down. It's probably for every 1 to 2 lakh patients who undergo anesthesia, one might end up with mortality directly as a result of anesthesia, which is very, very safe, and things have improved dramatically over the last 20 years or so.
Okay.
Yeah.
All right. And so what are the recent advances in anesthesia? What do you have to say?
I mean, like all medical specialties, anesthesia is evolving all the time. We are constantly improving in terms of the equipment we have, the technology we have, so we get a lot more feedback from patients than we used to a little while ago. Our drugs are getting safer, they're getting better, they're getting more precise. As doctors, we have a better understanding of physiology, of pathophysiology of disease, so we are able to take on increasingly high-risk work, which even a couple of decades ago, surgeons would not want to venture. Okay, but I strongly feel primarily what has changed is the culture of teamwork. Okay, anesthesia is often compared with aviation. It's what they say is it's hours of boredom punctuated by moments of terror. So anesthesia can seem like it's going swimmingly well, and then suddenly something happens to which you have to react virtually instantly. So in fact, a lot of training in the West especially focuses on non-technical skills like effective communication, resource management, and also situational awareness. A lot of this happens on a day-to-day basis because as anesthetists, we work with a large group of people, the surgeons, our technicians, obviously the patient being at the center of everything we do. So a lot of it, I think, that has really changed in the last few years has been a culture of teamwork and culture of multidisciplinary working.
Okay. All right. So how is pediatric anesthesia different from adults?
Good question. Again, children are obviously they're smaller. They're not just small adults, but they're definitely more fragile than adults. So technical procedures can be more difficult to perform in children. As anesthesiologists, we need to be careful in terms of titrating our drugs. So there's a great degree of precision that's needed, whether it's in the choice of drugs, choice of airway management. So all of that, there is a smaller margin of safety, as it were. But more than anything, what I feel is the philosophy of care is slightly different to adult anesthesia, because children undergoing anesthesia causes great emotional distress, not only to them but also to their parents. So in a way, we are actually looking after two people, the child and its parents. We are managing the expectations of both when we are doing pediatric anesthesia. Because as you know, a lot of parents feel a sense of loss of control.
Right.
So a lot of it is about assuaging them and doing a good job, keeping the child at the center of everything we do.
True. So how should parents prepare their children for anesthesia?
Again, another very good question, and what I always tell the parents I meet in a preoperative check is to tell the child a bit about the surgery, not so much the gory detail, but just to tell them that they're coming to hospital to have something at the end of which they will feel better. When I meet them, I offer them a choice of anesthesia, typically either a mask that is put across their face into which the child breathes and goes to sleep, or what I call magic milk, or what's called propofol. Yes, that is given into the drip in the hand and sends the child off to sleep. So even little things like this really helps if you prepare the child for what is to follow without going into the excruciating detail. I think it really helps. So that's something the parents can do. And another thing, if I may just say, is people often ask me how much information should we actually give a child, because it's going to scare them. My answer to that is always that honesty is the best policy when it comes to this. There are 8-year-old kids who are solving Rubik's cubes who can understand calculus these days. So to understand the basic process of anesthesia is not too much to expect from a child. And I feel often that the fact that we don't give them enough information and spring a surprise on them is what causes them to lose trust in medical professionals and in hospitals. So if a child is kind of made aware gently that something is about to happen, like I said again, not in any great detail, but just to kind of
make them feel comfortable.
Make them feel comfortable. And what I always tell them is just tell them that we are doing this for your own good, and that the parents will be around the child all the time. So the child knows that it's not in an totally unfamiliar environment.
Okay, all right. So finally, why do you think Sakra is, for pediatric cases, how are we better than the other hospitals?
What I would say is that we offer an excellent combination of technology and professional expertise. We have state-of-the-art anesthetic equipment. We have, surgical equipment here that is comparable to anything that I have seen in the West as well, in terms of whether it's monitoring, whether it's equipment. Our surgeons are expert surgeons, whether it's our pediatric surgeon or our ENT or plastics, neurosurgeons, cardiac surgeons, all of them are adept at handling children. When it comes to anesthesia, all our consultants are pediatric trained. And in fact, all anesthetists, all qualified anesthetists undergo a reasonable amount of pediatric anesthesia exposure during their post-graduation and afterwards. And in my own case, I am a UK board certified pediatric anesthetist. And what I think differentiates us from many other places is the culture of safety and quality that we have been trying to ingrain into Sakra as a whole, and Sakra anesthesia in particular. It is slowly becoming part of who we are. And it's something we've been working on for the last 4 years and will continue to work on.
All the best for that, sir, and thank you so much for spending time with us in clearing all the pediatric anesthesia-related queries.
Thank you so much for having me.
Thank you. Sorry, I couldn't look because